Good morning, everyone. I'm Dr. Abdul Tawfiq from SNS College of Physiotherapy, and today I'll be discussing about total knee replacement, which means TKR, in detail. We'll explore the concept by using the design thinking approach, emphasizing empathy, ideate, and effective solutions. Shall we start? Introductions. TKR is one of the most successful surgery in orthopedics. It's considering when the patient suffer from severe knee damage, usually from arthritis, that makes walking and daily activities difficult. The surgery is not used just about replacing the joint. It's about restoring the independence and improving the quality of life for the patients. Once and the definition coming to the definition, TKR is also called arthroplasty, involving the surgical removal of damaged parts of the femur, tibia, and sometimes the patella, and replacing them with artificial prosthetic components made up of metal and polyethylene. The main aim is pain relief, correction of deformity, and restoring the mobility of joints. So, coming to the problem, which means empathy. Now, let us empathize with our patient, then usually live with a constant pain, stiffness, and swelling. Even simple action, walking, climbing stairs, or sitting cross-legged become impossible. This leads to loss of confidence, some kind of small social withdrawals, and dependence of living. So when we talk about TKR, we are not only treating the joint, but also restoring the patient's mental, and social well-being. Coming to the causes of the knee damage, the most common causes of the knee joint are osteoarthritis, a degenerative condition, or other causes includes rheumatoid arthritis, post-traumatic arthritis after fracture or ligament injury, and less commonly tumors, infections, and congenital deformities. The post-traumatic arthritis means alignment dysfunctions, patellar dysfunctions, and knee joint instability, ligament instability, which also include in the post-traumatic arthritis. What are the indications? The indication is recommended when the pain persists despite medications, injections, or physiotherapy. Severe deformities like bow leg, knock knees, or restricted movements affecting daily life are strong indications. They are the key points in surgery. Considering key points for the surgery. Only when conservative measures fail. Coming to the goals are simple yet powerful: relief pain, correct the deformity, restore the joint's function, and improve independence. And ultimately, the main aim is to help the patient to regain the comfort and mobility of social confidence. What is a non-surgical method? Before surgery, we always explore the non-surgical treatments like physiotherapy, medications, sprays, weight management, and intra-articular injections, which means steroids. They work in earlier stages, but often fail in advanced arthritis like third grade, and it means end grade of arthritis, which is when the surgery becomes a better options when it comes to pain. When the TKR is not necessary. TKR isn't for everyone. If the arthritis is mild and are controlled with medications, or if the patient has good mobility, which means the grade 1 and grade 2 of grade 2, in some case of grade 3, which weight management has been reduced for the patient, the grades has been also reduced in the arthritis. In young patients, joint preserving surgeries are like osteotomy are preferred. Also, patients with severe uncontrolled comfortabilities may not be ideal candidate. What are surgical alternative? Surgical alternatives include high tibial osteotomy, and unique compartment knee replacement. But when the authorities involve the multiple compartments, TKR remains the gold standard. Pre-operative preparation. Before surgery, patient undergone through the evaluation of X-ray, blood test, ECG, any medical clearance, MRI, anything else. Rehabilitation with exercise helps strengthening the muscles or for faster recovery. The counseling is equally important so that the patient have realistic experience about surgery and rehabilitation with the mental health. Then surgical procedure. Under the anesthesia, an incision is made at the front of the knee. The patella is moved aside and damaged cartilage of the bone surface are removed. Step 2. The metal components are fixed to the femur and tibia, and polythene scapular is placed for smooth movements. If necessary, the patella is resurfaced before the closure. The pieces of surgical procedure ensure the long-term stability of the functions. Their procedure. Processes type. Processes can be cemented or cementless surgical approach. Vary of open surgery, minimally invasive surgery, or robotic assisted procedures which provide greater precautions and personalizations. Post-operative or long term. The post-operative or long term, maybe post-operative care. After surgery, the patients are monitored pain, infections, and clot risk. Physiotherapy begins within 24 to 48 hours with ankle pumps, gentle range of motion supported with walking. Complications may be include infection, stiffness, or implant loosening, but they are minimized with proper care and rehabilitations. What are the long-term goals? TKR has more over 90% of success rate with implants lasting 15 to 20 years of physiotherapy in vital ways with gently mobility, then strengthening and balance training or evenly functional activities are being more helpful than any other rehabilitation methods. AI-based rehabilitation and biological therapies like cartilage regeneration and shaping the future joints are most important and most be useful for the patients. Then conclusions. To conclude that TKS most is not just in surgery. Sorry. It's not just in surgery. It is an empathy prevention and rehabilitation by combining surgical and expertise with the physiotherapy will help the patients to regain their independence and improve their overall quality of life. Thank you. That's all for the today's topic. Hope you all understand. Thank you.